Hi, hello, good morning, good afternoon. Welcome to our Art Talks webinar series. And I'm really excited about today's webinar on understanding health insurance coverage. For many patients, this is a huge issue. Affording their treatments and the anxiety related to insurance and cost of healthcare can be so overwhelming. So I'm very excited to have Alicia Lawrence joining us today. Just by way of background, welcome. I'm Isabel Lusada, the CEO and founder of the Amyloidosis Research Consortium. And ARC, as it's also known, was founded in 2015 with a focus on really making a significant impact on the curability of amyloidosis. We have the model that we have developed is really around building collaborations to accelerate, in particular, drug development and access to treatments. We bring together all those in the field, the different stakeholders from clinicians, researchers, regulators such as FDA, payers, pharmaceutical companies, and really at the heart of what we do is patients who are really engaged across our programs to inform what we do. We have four major areas of focus: improving the speed and accuracy of diagnosis. We have two, the areas in the center that are really scientifically focused on understanding more about the mechanisms of the disease to identify new treatments, and then the pathway to get these developed and approved and reimbursed for patients. And also critically important is supporting patients throughout their journey with amyloidosis. And of course, our talks webinar falls into this last group. So I'd like to thank our sponsors today, and I'm delighted to introduce Alicia Lawrence, who's an Information and Resource Service Manager in the Patient Services Department at NORD. Some of you, and I hope many of you will have come across NORD, which is the National Organization for Rare Diseases, and does a phenomenal job across a whole range of programs in supporting the rare disease patient and research community. She's in the lead provider of quality information resources at NORD's rare disease community. Alicia has been in the field of social work for over 20 years. And with her experience, she's able to assist patients and caregivers in navigating the difficulties of having a rare disease diagnosis. Alicia is also passionate about advocacy as it relates to fragile populations in the areas of physical and mental health, as well as social justice. Alicia, we're excited to have you share with us today, and I'll now hand over to you. Thank you so much for joining us.
Thank you again for having me. I truly appreciate the opportunity. Again, my name is Alicia Lawrence, and I am the Information and Resource Services Manager at NORD. And what our role is for the Information and Resource Services team is that it allows for, if a patient calls and we don't have a patient assistance program per se, calls are forwarded to my team and we are able to provide additional resources to patients. Next slide, please. NORD's mission is to improve the health and well-being of people with rare diseases by driving advances in care, research, and policy. Next slide, please. Just a little bit about NORD's background. We were founded in 1983, and we represent over 300 different rare disease patient organizations and 25 to 30 million Americans living with rare disease. We are committed to identifying, treating, and curing rare disorders through programs, education, policy, research, and patient services. NORD began as a small group of patient advocates that formed a coalition to unify and mobilize support to pass the Orphan Drug Act of 1983. But that was just the beginning. Since then, the organization has led the way in voicing the needs of the rare disease community, driving supportive active policies, furthering education, research, and providing patient and family services to those who need them most. Together with our over 330 disease-specific member organizations and more than 17,000 Rare Action Network advocates across the 50 states and national and global partners, we deliver on our mission to improve the lives of those impacted by rare diseases. Next slide, please. Just some of the challenges for those who do have a rare disease is that sometimes it can take an average of 5 to 7 years to get a diagnosis. There are few medical experts in the field, little research, small scattered populations, which can lead to social isolation, extensive long medical needs, and over 90% of rare diseases do not have an FDA approved treatment or therapy. And more importantly, high cost and care of treatment. Next slide, please. That brings us to our topic of discussion. So let's start with some of types of insurances. There are various types of insurances, but for the sake of this webinar, we'll concentrate on 4. So the first is Medicare. Medicare is a federally funded program, usually for those who are 65 years or older, and also individuals that are younger who may have a disability. It's important to remember it is the same nationwide. Then we have Medicaid. Medicaid is a joint federal and state program that helps to cover medical costs for some people with limited income and resources. The important thing to remember is that Medicaid, it varies from state to state. So each state has a different criteria for Medicaid. Next slide, please. We also have the Health Insurance Marketplace, which is also a federal program, but it's more so for those who do not qualify for traditional Medicaid. It, like I said, it is run by the federal government, and it helps families and people and small businesses to be able to afford health care. And then we have commercial health insurance, which is also called private insurance, which is usually through private entities, companies, and it's important to remember it's private, so it's not issued by Medicare or Medicaid. Next slide, please. There are 4 parts to Medicare. There's Part A, which usually is for hospital stays. Part B, which is for medical coverage, so such as doctor visits, specialists, some durable medical equipment, and also home health care. Also under Part B, there can be times when prescriptions can be covered. Usually it is through doctor's offices, hospitals, or infusion centers. It would be important to just make sure to speak to your pharmacy or provider to find out if that Medicare Part B coverage is applicable to the medication that you would be receiving. Part C is the Medicare Advantage plan. And so under that, you have dental, vision. Some plans offer wellness types of incentives as well. Next slide. Part D is the prescription drug plan, usually through private insurance carriers that follow rules set by Medicare. Also important to remember is that most Medicare drug plans have coverage gaps, which is also called the donut hole. This means there's a temporary limit on what the drug plan will cover. Once you and your plan have spent 4,000, well, for this year, because it does change, $4,660 dollars, you're in the coverage gap. This amount changes, like I said, from year to year. Also, people with Medicare who get extra help paying Part D will not be entered into the coverage gap. And we'll talk a little bit about extra help later on. Some things to consider to try and prevent from going into the donut hole is, if possible, switching to lower cost drugs. And again, that's for our population, that's not as easy as for someone with a chronic illness. Also, it's important to choose a Medicare plan that offers additional coverage during that gap, if you can, because with that, it does come with a higher cost in monthly premiums. There's also pharmaceutical assistant programs. There's also state pharmaceutical assistant programs, which again vary from state to state. So you'd have to locate, your contact information for your particular state. And then again, like I said before, there's also extra help, which is what Medicare and Social Security have put in place for people with limited income to be able to afford their prescription costs. Next slide, please. So we did talk about the fact that you can buy an enhanced Part D plan. It is something that you can do. However, it does unfortunately come with a higher cost. If you can also do, if you're a retiree and your spouse or you were working, sometimes companies have retiree drug coverages as well. And again, the Medicare Advantage plan is also helpful because it does put into play all of the vision, dental, prescription, which may help to lower the cost of drugs in that respect. Um, as far as finding the appropriate drug plan, uh, it's important to remember that you need to make sure that you find a plan that suits your needs. Everyone has individual needs, and so it's really important to keep that in mind. This can be overwhelming because there are so many plans, and Medicare has put into place what's called the State Health Insurance Assistance Program, which is an opportunity for agents and brokers to assist in ensuring that you enroll in the right plan. This is a free service and it does vary from state to state. So again, it would be important to find out what the SHIP assistance plan, the state health insurance plan would be for your particular state. Another thing to keep in mind when choosing a plan are just a few things to remember. Premium, which is what you'll pay each month. You want to make sure that it's something that is doable and you're able to afford. Also, the deductible, which is what will you pay for services before the insurance starts paying. Your co-pays, and this is what you pay once your deductible has been met, and then your co-insurance, which is the insurance will pay a percentage of the bill, and then you may be responsible for the remainder. So like for a Medicare recipient, usually Medicare will pay 80% of a hospital stay, and then the patient would have to pay the 20%. Next slide, please. So other things to consider is, of course, many of us would want to be able to keep our medical providers. This is extremely important for the rare disease community as it's already difficult to find providers who understand the complexities of having a rare disease. You can speak to your present providers' offices to find out what plans they're part of, and also for your Part D prescription coverage, you would want to speak to the pharmacy about current medication and plans that your current medication falls under. It's important to review this every year because insurance companies do change their formulary from year to year. Next slide, please. With that being said, open enrollment is actually going to be coming up in a couple of weeks, and open enrollment for Medicare is from October 15th through December 7th. During this time, you should review with your providers as well as prescription coverage to make sure that it's going to remain the same, or if it is that you'd have to change plans due to changes in formulary in the current insurance plan you're in. And again, for your medication, you can find that information out from your pharmacy or your provider's office. Next slide, please. So just to recap, government issued insurance is Medicare, Medicaid, and the health marketplace. Commercial insurance is covered by private companies, entities like such as the Aetna or Blue Cross. Now, these two are also under Medicare, but they follow Medicare guidelines. So those are just some important things to remember. Next slide, please. I just want to talk about some keywords to also think about when we speak about insurance. And approval, it means that your insurance company has approved your medication, your tests, your treatments, or the providers that are under your plan. Denials is when the insurance company refuses to pay for services rendered. And this can happen for a few reasons, maybe going to an out-of-network provider, not getting prior authorization from your insurance company before services such as like an MRI or certain lab test or diagnostic testing. And again, talking about medications that are not on formulary. So formulary meaning that they're not part of the present plan that you're in. Also, sometimes having the wrong ICD-10 code or wrong information can also deny a claim. Appeals are when and you have this right, this is every patient's right, is to review the claim that is being denied. There are different time limits on appealing a decision, and it is varied from state to state. So you should, if you know that something is denied and you want to start an appeal, you should do it as soon as possible. You should make sure that you have all of the information about that your insurance is looking for, and will need to review in order to approve your appeal. So it might be medical records, physician notes, and your provider office should be able to help you with that. If you're unsure about the documentation needed, you can also call the insurance company or check their website. Usually those things are on the website as well. Again, anyone can apply for appeal. It could be yourself, your doctor, a nurse, or even the pharmacist. Next slide, please. So my insurance company rejected my claim despite everything I've tried. So you may go have an appeal and you've tried to appeal the decision and the insurance company is still not wanting to turn over the decision. So there's two types of appeal, an internal review or an external review. An internal review, like I said, you have the right to request this, and it's so that you can do like what's called a peer-to-peer with an expert who may know about rare disease or your particular diagnosis, and they can possibly help to reverse the decision. An external review is also your right, and it may be that medical judgment that you or your provider feels you agree with what the plan is saying. Any determination for treatment is experimental, investigational, or off-label use, which for rare disease community can happen. And any cancellation of your coverage if your insurer claims that the rejection was due to you providing false information or incorrect information when you applied. So those are just some of the things to consider. Next slide, please. So we talked about formularies and just prior authorizations. So medication and treatments may be on special formularies that may require prior authorization. What that means is that your insurance company wants to verify that the prescribed treatment or medication is necessary and appropriate for you before they begin to cover it. If you are unsure that you need prior authorization, you can call your insurance company to find out if your provider is unaware. It's very important that if you feel or that something may need prior authorization, that you do it immediately because it can take up to 2 weeks to be approved. And you want to be able to kind of expedite whatever needs to be expedited so that you don't lose any loss in care. Next slide. There are a few things you can do to help the prior authorization process. And doing this may help to, again, shorten the time frame. So it's important to remember that insurance companies are often unfamiliar with rare diseases. And in order to help with coverage, it's best to inform them of your condition for better understanding of treatment options. You can get the ICD-10 code from your provider. They would be able to provide that information to you. Also, too, you want to make sure that your provider, your pharmacy, and medications that are taking are in network prior to any future medical visits you may have. Verifying this information will make sure that things are covered and that you won't have any issues in the future. If you're unsure if something is not covered, whether it's a treatment, a provider, or a medication, request that your insurance company does what's called a test claim, which is they can simulate a claim to see if it'll go through. And if it does, at least it'll give you some comfort in knowing that, it's going to be covered. Next slide, please. So I don't know if many of you know, but we're coming into what's called the Inflation Drug Act, or the IRA, which is what is being put into place to negotiate prices directly with participating manufacturers for selected drugs that have a high total spending or a high expenditure single source drugs without genetic or biosimilar competition. There are some positives with this as it relates to the rare disease community. So the IRA will cap patient out-of-pocket spending on prescription drugs for Medicare Part D participants. So starting in 2025, out-of-pocket costs for Medicare Part D participants will be capped at $2,000 a year. Monthly out-of-pocket costs can also be capped starting at 2025, helping to make sure patients aren't subject to a huge out-of-pocket expense in the first few months of the plan. CMS is already required to ensure negotiated drugs available on this formulary, but it can go further by requiring negotiating drugs be placed on a higher formulary. Another positive is that under the IRA, certain orphan drugs will be exempt from price negotiation, and CMS has made it clear that this exemption includes drugs that have been FDA approved for multiple indications tied to treating the same rare disease. This means drug companies won't be penalized when they continue to further develop rare disease drugs for additional population subgroups such as children. Next slide, please. So, what is NORD doing to educate the rare disease community? Small patient populations and medical complexities associated with rare diseases can create very unique challenges for our rare disease community, as well as rare disease drug development. And these same complicating factors may also make it difficult to determine fair negotiating price for products that treat rare diseases. At NORD, we have several concerns, and we hope that CMS will address to ensure that the rare disease community fully benefits from the IRA. Lastly, NORD did do a webinar with the Centers for Medicare and Medicaid Services, where we asked some of the rare community's most pressing questions about implementation of the Inflation Reduction Act. Next slide. This is a lot to remember, so I will go over some things that are important. It's important to remember that Medicare is a federally funded program, and it's really important that open enrollment starts October 15th through December 7th. And again, it's important to review for those individuals who are on Medicare plans. It's important to review and make sure that the information that you or the services that you're currently under continue to be that way. If not, again, you can reach out to Medicare to find out what plans will continue to meet your needs. Remembering Medicaid is a state funded, is federal and state, but it varies from state to state. So just keep that in mind. And we also, again, have the health insurance market for those patients or families who do not qualify for traditional Medicaid, as well as our commercial health insurance. Next slide, please. So NORD has an entity called the NORD Rare Action Network. And under that, we have what we call NORD state report cards. And what these state report cards do is it projects the goal of evaluating how effectively states are serving people with rare diseases. It's something that, you know, if it is that you would like to obtain, we're going to do a resource list. I'll get that to you. Also, what we do on Reaction Network is connect other patients, caregivers, stakeholders within a state or region through calls, webinars, and in-person meetings. You can participate in regional or local events to connect, learn, and address the nation's leading issues. We develop relationship with key decision makers, and it's also an opportunity to share your story and to bring patient awareness to rare diseases. And just again, a reminder about prior authorizations. Just make sure that you that you do it immediately, because again, it can take up to 2 weeks to get that finalized. Next slide, please. On our website, we do have an information sheet with important items to remember as it relates to Inflation Reduction Act. And then again, these links will be placed in a resource so that you can have it. It's a nice condensed version of the IRA, which may be helpful for you. Next slide. And if you have time, you please feel free to watch the webinar. It may answer a lot of the questions you may have as it relates to the IRA. Next slide, please. So our communication center within the Patient Services Department is here to provide any assistance you need. We're available Monday through Thursday, 8:30 to 7 Eastern Standard Time, and Friday, 8:30 to 6. I know this is a lot of information, but I'm hoping that you found it helpful. And our information and resource services team can be reached at 800-469-0283 or via email at information services at rarediseases.org, and I can be reached at alawrence@rarediseases.org. Next slide. Thank you for your time today, and I appreciate again the opportunity to have been able to bring this information to you.
Thank you so much, Alicia. There was so much great information, and I neglected to say at the beginning of the talk that if people have questions, type them in the Q&A box, and we'll have time now for some questions. So we have a couple of questions that have already been entered, and please feel free to add more, and we'll share those with Alicia over the next little while. So there's a question which says, where does TRICARE fall into this discussion?
So that is a separate entity, but at the same time, there are a lot of participants who do have the TRICARE. And again, I would just, the same thing, make sure that your providers, your pharmacy, your medications still fall in the realm of your plan. I would still be the same criteria.
Okay. And then, as you know, that in amyloidosis we have a couple of approved, or a number of approved treatments that have high cost associated with them. What's interesting that particularly in TTR amyloidosis, we have a drug called Vyndamax, also known as tafamidis, that falls under Part D. We also have two other gene silencers that fall under Part B. And so that's something most patients are prescribed one or the other, although some patients are able to get those in combination, but there are real complexities around that. And I see we have a couple of questions that relate to that. So this was around for Vyndamax, which falls into Part D. If my Medicare Advantage plan does not approve Vyndamax as a Tier 5 drug, what are my options?
You can appeal the drug. So when we talked about the appeal process, it would be the same thing. You can have your provider, you could do a peer-to-peer, but you have to do the steps. So you initially have to open the appeal process or the appeal with your insurance provider and follow the steps. Now, if it is that the insurance, we get calls about this all the time that, some patients feel like every time they need to renew the prescription or the drug, that they have to go through the appeal process. For some, that is the only way that it's going to get approved. And so I would just encourage you to go through the appeals process and see what happens. If it is that you're finding that it's still not being approved, then there are other options. And again, I don't want to get into that on this, but you could always contact our information services team and we can kind of walk you through what the next steps would be. But you should always start with the appeal with your insurance company.
And we've certainly seen that with some of or many of the centers that have amyloidosis programs work with their specialty pharmacy, and that needs to be helpful too, right? The role of specialty pharmacists.
Yes.
And there's a question which I think you answered well, but it would be, I think, good to reiterate that once the Inflation Reduction Act comes in to effect, what will the new Medicare Part D, what would the maximum I'll pay for Vyndamax with Medicare Part D?
Well, that's a very specific question. So, up until 2025, I think they're looking to kind of slowly bring it up, but then once 2025 hits, I think at that point it will be, I think it was 2000, if I'm not mistaken, that you would, the out of pocket, it would be capped at that. It's one of those things where we kind of have to just see what happens.
Yeah.
Especially for our community. I mean, not to say that to downplay chronic illnesses, but for rare disease patients, it's very specific and a different platform. So, we just would have to wait and hopefully see what the outcomes as it relates to our community.
And there's a question that sort of ties into this that says, if an insurance company drops a drug from its formulary, will that drug still have that maximum, what we hope is 2,000 annual out-of-pocket expense limit?
I'm gonna think probably it's just because it may not be on maybe a present formulary, but it could be on another insurance company's formulary. It may not, and I'm just throwing this out here, it may be on getting dropped from Aetna, but then it may be on Blue Cross. That's why it's important to make sure that you really look at what your plans are covering each year, because from year to year, depending on the expense of the drug, it can be dropped from from a provider's formulary.
Mhm. And how can I determine if my Medigap policy covers my meds?
So again, you can go through your pharmacist, or you can call the insurance company directly. Um, you know, Either way would be fine. It's not something that, you would know offhand. So you would need some help. Your provider may be willing to do that, but I think it would be best to call the insurance company or your pharmacy to just see what the coverage gap is.
Mm-hmm. And there's a question which I think a lot of people we've heard is that even though it might be a drug might be approved now this year, is there a chance that they could deny coverage next year?
Yes, yeah, unfortunately, yes, because we
And
get those calls too, but then again, if it is that it is denied under the appeal, then you can also then request the internal appeal and then also the external appeal.
Mhm.
So, it could be that it could have been approved through an appeals process for years, and then all of a sudden it then becomes that it's not. And so we get calls about that as well.
And there's a question that says, is the SHINE program, SHINE, SHINE, in Massachusetts the same as the SHIP program?
Yes. So each state has a different name for their Medicare assistance program as far as finding brokers. But yes, there are also, everyone has a different name, just like Medicaid is, like in New York, it's Department of Social Services, but other places it's Human Services. So the acronyms for each state are different.
And how can I find out the rationale behind, and I think you did touch on this, behind exclusions noted in insurance prescribing policies, especially if they're counter to expert thinking?
You have to go through the process, that's where the peer-to-peer comes in. You can request a peer-to-peer, which would be, for the insurance company to find a provider that is educated on the diagnosis. That's what an internal appeal really is. Um, and you can advocate for yourself for that. You have that right.
If I have, or I have Medicare and just wanted to know, is there a specific insurance that has better coverage?
Well, again, it depends on your needs. So it really would be important to look at what your needs are. If it is that you like your providers and you want to keep your providers, then, you know, it would be looking at going to your doctor and saying, or your specialist and saying, can you tell me what plans you participate in? If it's as far as um, your medications, uh, find out from the pharmacist what plans take this particular medication. And then again, you want to keep in mind costs and making sure that you're not going to put yourself in a hole for the premium. But the best place to start is to just make sure that the insurance company that you're looking at will cover your providers and your current services you have in place, your medication specialists and providers that you see.
And it seems like really setting up calls with those companies or with the Medicare, with the helpline you provided,
Yes.
like, is the best place
Yeah,
before.
yes. Because, it can be very overwhelming. And so, I always tell patients to start there, but if you feel like that's still not enough, then yes, call your state Medicare helpline. And, like I said, it's free. It's not anything you have to pay for. And they'll ask you a series of questions to make sure that they are able to provide you with the best carrier to meet your needs.
And this is a good question, because I feel for many of us that, you feel you're just facing this mysterious concrete wall that you never know who is behind it. So to whom are you appealing, and who is it that decides?
You're appealing to the insurance company, and it's a whole process. So that's why, sometimes it could be you send your paperwork to the insurance company and then it gets assigned. But when you do a peer-to-peer, it's one person. It's one person. And sometimes it could be your doctor and the insurance company finding a doctor or having a doctor to kind of have a conversation. So, it really does depend on the insurance, the process of the particular insurance company. And the appeal information regarding how appeals are done usually are part of the website, because it's part of a process. It's information, so it has to be available for you to review.
And a good thing to do is partner, I would think, with your healthcare provider.
Yeah, don't do that on your own. I mean, you can look, to investigate it, but yes, it would your providers usually, especially if it's someone who is familiar with the rare disease community, I'm sure they have come up with not just yourself, but other patients who have been denied for particular services and medications. And it's probably, I hate to say it, used to having to do these appeals. So, it might even be a question if you go to a new provider to say, hey, are you familiar with how to do appeals? Should it come up? Prior authorization, should it come up? Just so that, you can feel comfortable if those things should, happen, that person, that provider knows how to kind of handle it.
Mm-hmm. There's a question which is from, if a patient is visiting the United States and has a traveler's insurance, what's the best way for him to get a treatment after diagnosis? And that's kind of a very specific question. So
Yeah. Again, it depends on the policy.
yeah.
It depends on the policy. What the policy will allow. So that is that would be something, especially, yeah, that's very specific. But I would say it would depend on the policy. It's almost like we would just have to, I mean, we don't want to, but see what it is that would be the next steps in that case.
Yeah. And I think absolutely looking at the fine print, speaking with the
Yes.
company is important. Don't jump into getting a treatment without speaking with that insurance company beforehand, travel insurance. There's a couple of questions around copay assistance programs, which currently a lot of patients use to help cover the copays. And might not know now, but how do you see those changing as we move towards 2025?
I wouldn't be able to answer that. I mean, I think it's something where, we hope that, we would continue to have these programs, because again, everyone's situation is different. For some, it's still a lot of money, you know, um, to come up with. For others,
Mhm.
it's a relief, but for others, it still could be still a thing of where am I going to get that money from? So we can only hope that, you know, we can continue to be able to help all of us who have patient assistance programs will be able to continue to help those in need.
And I would just add to that at ARC, we did a survey last year for affordability and the impact of cost and copays that patients were paying, to understand how to better advocate for programs and ensure that the right assistance programs were available and in place. something we will continue to do. So if you are experiencing changes and challenges, do let us know, reach out to us. NORD is also very good at keeping an eye on these things and advocating strongly to ensure that these programs remain accessible, available, and cover the need of patients. There's a question asking, says, do specialty centers and thinking about specialized in rare diseases or in a specific disease, have better results of obtaining approvals?
That's a good question. I would almost feel that's a possibly, only because of the fact that, maybe they have made a name for themselves as it relates to being a center of care for a particular diagnosis. And so they have the experience of working with insurance companies, kind of knowing the language. I think that comes with being, doing it on a regular basis. So possibly, I would hope so anyway.
And I think we certainly see that that amyloidosis centers they at least know how to work. They have the supporting documentation. You will not be the first patient they've seen that has the same, potential conflicts with their insurance companies. So they will be able to provide that supporting information and advocate on your behalf. So I think that's something that there is a benefit being at a center that's used to thinking of your disease and prescribing these particular medications. If all appeals and internal and external reviews result in denial for a drug, the experts agree is medically necessary for you, you have options for reconsideration.
I missed that. Can you say that again? I'm sorry.
So it sounds like when you've, are there any other avenues when you've explored every avenue that's available?
Yeah. So also too, we sometimes tell patients, if they've done, we make sure that they have gone through the entire appeal process. You can go through your state's health insurance. Every state has a health insurance that overlooks everything. Also, some have gone to their local representatives. You're in Congress, your local representatives or senators have health and wellness entities on their staff. And, maybe that could be a way to get what you need as far as medications too. Maybe they would have some other resources. Also too, we have, in my role at NORD, we do get calls where patients say they have tried all, means, and then we look at other resources or other ways, like whatever else is maybe going on, and try to tap into other resources that may be available that are not necessarily medical, but maybe on another, household, to maybe free up some medication. So we tend to work with the patient, try to think out of the box a little bit to be able to see what we can do to assist. But I would say, start with your state health insurance fund, and then again, maybe you do have to go to your local representatives and see if they have any ideas or can advocate as well.
Absolutely. I think that's very good advice. Will I be considered, quotes, commercially insured once I turn 65 and will be covered by a Medicare supplement plan?
No, you will be under Medicare because it's a Medicare supplemental plan. So you have to remember that it is a supplemental plan, but yes, it's a supplemental plan through like a Aetna or a United or AARP. However, it follows Medicare guidelines. So it's not considered commercial insurance. It is still considered a supplemental plan, Part D coverage, or supplemental. Even a supplemental, it's still the same thing.
Okay. So there's a question which is fairly specific to amyloidosis. You might have seen it elsewhere, that we have a number of expensive drugs that could be considered complementary to take. So what are the odds of both being approved? Meaning if we have no study to show benefit of both medication, do you think appealing would still help? And we're very early. Approvals have been in recent years, and so we don't have the evidence yet to show what a combination of therapies looks like.
I think it's worth a try. You know, you never know. You never know who, the other thing is too, you don't never know who at the insurance company is reviewing the paperwork. And so, I think it's just something, you have to we all have to try, even in our, daily lives. If it is something that we're not sure, but maybe it could happen, you just go for it and just see what the outcome is.
And I would add to that studies have not yet been conducted in looking at the benefit of combination therapies. And so there is an unknown. It shouldn't be assumed taking two medications, even though they have different methods of action, better than one, or we don't yet know the risks associated with that. It's something that we need to study as a community, and I think there is a commitment to do so. And hopefully we'll know more about this. And the ideal is that we have that data and the research done to know what's the best treatment for each patient at the right time. So that's ongoing work that needs to be done in research. And just looking at any more questions. I think there's the one, and I think maybe just clarifying a little bit more, or running through again about the donut hole and how that works would be helpful.
So, just again with the donut hole. So it is not everyone falls into that coverage gap, and it tends to begin after you've reached a certain after certain drugs have been covered. So like for this year, and again, this changes on a year-to-year basis, once you and your plan has spent at least $4,600, give or take, you're in the coverage gap. If you have extra help, which I encourage, everyone to try and see if it's something that you are eligible for, it really is helpful because when you get extra help, you don't fall into that coverage gap. And it can vary again depending on what your deductible is as it relates to the insurance. You may want to call the insurance company to just find out, because again, you may not know until you go to the pharmacy and you realize you have this astronomical gap, and you're like, how are you going to get to it? So it really is important to maybe speak to the insurance company and make sure, where do you fit as it relates to the donut hole. And it could be it's very individual, so depending on the cost of your medications. So
I think that's very helpful advice. And as people are considering which plan to take, really consulting around that and getting as much data as you can before you choose your plan. You talked about Medicaid varying state to state, and I think a question we often get from patients is around being seen out of state. Is there any in-state versus out-of-state things that you should be concerned about or consider?
So I'll just give an example of so we do get a lot of calls related to seeing a provider that may not be in the state and is out of state, and some insurances will cover it, but again, you have to make sure that you take the necessary step to contact the insurance company to make sure it's something, or even the provider office that you'd like to go to. You can even call them to see if it is possible that they, do they know? And then we talked about the simulated claim. See if your insurance company would be willing to do a simulated claim to see if it would be covered. NORD has rare disease centers of excellence throughout the country. And so when we send information about that, we always encourage whoever we're sending it to make sure that their insurance company is going to pay for the visit. In some cases they do, but it's just always, again, important to make that call beforehand and not just make the appointment and then assume that your insurance company is going to pay for it.
Yeah, absolutely. Thank you so much for answering so many questions and a really great talk. And I'm sure people will have good guidance now and will make use of that in making decisions about both the healthcare policies they choose and also navigating their insurance as they have both hospital visits and getting coverage for treatment. So thank you so much, Alicia, for the talk today. And I urge everybody to, we will share afterwards the resources that Alicia's talked about. Please take a moment and check out NORD. If you want to learn a bit more about the Inflation Reduction Act, there's the webinar she spoke to, and I think that's available, right, to watch?
Yes, it's available on our website. So you could either go into the search and search webinars, or even put in inflation reduction, just put it in and it'll come up. And again, I'm gonna make it part of the link part of the resources that we'll share afterwards.
Excellent. Thank you so much for your talk today.
Thank you. Thank you guys for having me. I appreciate it. And hope it was helpful information and not too much.
Very much so. Excellent. Thank you.
All right. Thank you.
Thank you.